Welcome to Pursuing Quality Long-Term Care, an educational podcast for individuals needing long-term care and their families. Join us as we talk with national experts and advocates about strategies you can use in the pursuit of quality long-term care. As we are finding our way out of the COVID-19 pandemic and public health emergency that devastated so many lives, particularly in nursing homes, there is an opportunity to look back at what happened, both the good and the bad, and find the lessons we can learn from to perhaps do better in the future. In this episode, Consumer Voice Executive Director Lori Smetanka talks with David Farrell, a licensed nursing home administrator who has spent his entire career in the long-term care profession, about the long-term care facilities that had better outcomes than their peers, or as David notes, facilities that weather the storm of COVID-19 and staffing crisis.
Hello, and welcome to today's episode of Pursuing Quality Long-Term Care. I'm Lori Smetanka with the National Consumer Voice for Quality Long-Term Care. As we're finding our way out of the COVID pandemic and the public health emergency that devastated so many lives, particularly in nursing homes, there's an opportunity to look back at what happened, both the good and the bad, and to find the lessons we can learn from to perhaps do better in the future. This is particularly true in evaluating what was happening in long-term care facilities prior to and during the pandemic that affected their response to COVID-19 and the subsequent increase in staffing shortages that many facilities are currently experiencing. So today we're going to be talking about those long-term care facilities that had better outcomes than their peers, or as our guest today notes, facilities that weathered the storm of COVID-19 and staffing crises. So our special guest today is David Farrell, a licensed nursing home administrator who has spent his entire career in the long-term care profession. At the age of 21, David started as a nursing assistant to earn extra money while attending college, and that experience inspired him to pursue a master's degree in social work with a concentration in gerontology and administration from Boston College. Throughout a career spanning 33 years, David has consistently implemented patient-centered care using quality improvement practices. A published author and former member of the board of directors at the Pioneer Network, his books, co-authored with Barbara Frank and Kathy Bradley, have received widespread acclaim. Currently, David is working for the Alameda County Public Health Department on the long-term care facility outbreak team, where he's helped support over 600 long-term care facilities in Alameda County, California. David and his colleagues did a deep dive into those facilities that were outliers or stood out from their peers with regard to COVID-19 infections and staffing shortages in Missouri to try to determine what was happening that we could learn from and hopefully replicate. So David, thanks so much for joining us today.
Sure, my pleasure to be here.
So we know that those living and working in nursing homes were disproportionately affected by the COVID-19 pandemic. More than 200,000 residents and staff died, which was 23% of all COVID deaths in the United States. And in addition, staffing shortages began being reported at crisis levels, yet some nursing homes did better than others in containing the spread of infection and in maintaining staff. So talk a little bit about how you found these homes and what then happened next once you found them and what you were looking at.
Sure. Well, it all started with my work with the Alameda County Public Health Department here in California, Alameda County, California, where we have over 600 long-term care facilities and 70 nursing homes. So in my role here working for the outbreak team, of course, I've been exposed to those facilities that performed poorly. And I've probably gone into 100 different nursing homes that have performed poorly here in California, Nevada, New Mexico. So I began to see the themes, of course, of why. And then it began to struck me as I looked at the data in Alameda County that not all the homes were faring poorly. And there were some that just stood out. They were positive deviants who just over and over again, no matter what the wave was, they just didn't end up on our list. They weren't reporting outbreaks. Or if they did, they were small, they were short, with very few hospitalizations and zero to very few deaths. So we ran the data and I went out and began to use some structured interviews to find out, what did they do? How did they do it? Were they lucky? Was it something to do with having all private rooms or some other structural advantage? And then we spread the study to Louisiana, Missouri, and South Carolina. So overall, we've interviewed 32 what we call outliers, facilities that had better COVID outcomes and better staffing outcomes than their peers in 4 different states.
Mhm. Well, it was really interesting as I was reading the article that you shared with me about the study that you did and looking at it, that the successful homes, there wasn't like one commonality about them in terms of size or in terms of location or structure, that they were different. They were different sizes. Some were rural, some were urban, some were nursing homes, some assisted living. So what does that say to you?
Well, so much of their success was about the leadership team and the staff they had, and some of the, organizational, evidence-based practices that they had in place before the pandemic ever began, like good, solid leadership, high staffing levels, low turnover, those types of things. So many of them had, if that was their advantage, that was a very common advantage. But of course, once again, any nursing home could achieve what I just described if they choose to follow, the evidence base that's out there. But it says that basically you could take the administrator and DON and IP of these homes and put them anywhere, and they'd likely be very successful within a few months. So we didn't find structural advantages as the theme. We didn't find all private rooms as the theme. We didn't find not-for-profits as the theme. We didn't find rural versus city as any type of theme. So they were a very diverse group of outliers that we noticed and studied in these 4 different states.
And I think, that is important as you look at what those commonalities are that lead you to better outcomes. This, and you talk about, transformational leadership style, and that really led to a number of the other pieces that help, the transformational leadership style seemed to help stabilize the staff and maybe led to reduced turnover or, better outcomes with residents. So anyway, could you talk about what the transformational leadership style is and what does that mean?
Well, in the literature, they refer to the transformational leadership style that, derives good nursing home outcomes as leaders who can, engage and energize and inspire a group, despite the circumstances. And nothing was more difficult to do during COVID outbreaks than keep your forces, engaged and, following strict infection control policies, and donning and doffing requires staff to be really engaged in what they're doing, right? And so that's what transformational leaders do. They're also very inclusive. They're very they communicate well. They're very they're consensus style leaders. I mean, they embrace huddles, they embrace input, and they follow the input of their staff, basically, and they're humble. They don't act like they know it all. They're not autocrats. They let people know what they're thinking. They ask for feedback. And in COVID, that was critically important. Leaders only knew so much, and they'd have to say that over and over again, but they were honest about it, and they would describe that to us in the interviews that we had with them.
And it sounds like, the people that you were looking at, they had these styles that were incorporated even before COVID. So, while a lot of facilities were certainly rattled and shaken by, seeing COVID come, it almost seems like these nursing homes or assisted living facilities, they had better systems in place with which to deal with the challenges that were coming towards them. Is that what it appeared to you?
Yes, yes, and some of those systems would be, as I just mentioned, that they were already having regular huddles with the staff, and those weren't interrupted by COVID. They were just more spread out by 6 feet or whatever.
Mhm.
They already consistently assigned their staff to the same residents every day. So they were already set up for the staff to notice a subtle clinical change that could lead to a COVID test and an early identification, compared to, let's say, a registry nurse who doesn't know the resident well and the resident has advanced dementia and can't speak for themselves. They would never notice a subtle clinical change for a quick test and early identification. So, consistent assignment, huddles, community meetings, and as I just mentioned, just humble, inclusive leadership. And higher staffing levels, to start with, right?
Mhm.
I think what went nationwide was the story of a nursing home in Los Angeles where the day after their first positive case in a 99-bed facility, only one CNA showed up for day shift the next day, and the nursing home had to be evacuated. That would be the other end of the spectrum of what we found in these outlier facilities, the other end of the spectrum, right? And that facility, you have to assume that those leaders, were not staffing well, they were not inclusive, that the staff abandoned them, right? The staff abandoned them, and that's not, on the staff, that's on the leaders. That's how I
Mhm.
see that.
And it's the relationship, that
Exactly it
the
is.
leader builds with the staff. And we've obviously been doing a lot of work looking at workforce issues and looking at staffing levels and talking about turnover and what is it that leads to all of those things. And what we hear over and over again is, sure, people need to receive a living wage and benefits, and that is a really important aspect of their job. But one of the most critical things for many of the staff is that relationship that they have with their leader. That they feel that they're part of the team, that they feel valued, that it is a good job, that they feel that they're not only contributing to, but feeling valued as part of that. And
Oh,
it sounds like that is really what was happening in these facilities.
yes, yes. As Vivian and Mary Tellis Nyack say, nothing moves a CNA more than an administrator or a DON. Nothing impacts her quality of work life or quality of home life more than those two individuals right there. Why? Because they create the work environment, which is an extension of how they view her as a person and whether they value her truly. And so these leaders that we find in these homes are really good at kind of buffering the daily irritants that can make a tough job even tougher in a nursing home. And that's what they're just really, really good at.
Mhm.
And so even throughout COVID, what we learned is that they would take the drudgery out of testing by making sure that the activity department or the management team or the dietary staff were handing out muffins as they did the testing or little prizes. And the kids would often have to watch their parents be tested in a line of cars, and they would give the muffins to the kids. And so they made testing kind of fun. And then another nursing home took the drudgery out of learning about COVID guidance by using their video display system and posting questions and raising the competence of the staff. If they answered the questions, they got points, which led to prizes. So they were taking a tough situation and trying to make it fun. And in addition, they had specific policies that not only led staff to be more transparent about their exposures, um, But of course, that led to people being quarantined timely before, they possibly spread. So they had the trusting relationship that you just described. So someone would report their exposures, right?
Mhm.
At screening. However, that really isn't enough for a low wage earner who has no PDL time and is facing
Mhm.
2 weeks at home with no pay. And how will I pay the rent, right? And so many workers in a nursing home fit that low wage category. So
Right.
the outliers always had a safety net to ensure that not only would they have the relationship to report, but they would guarantee that they would not be, that they would pay the rent. So, in one case, they just, doubled the PDL accruals. And many other cases, they allowed the staff to have a negative balance in their sick pay.
Right.
Others had safety nets where they would just pay the rent or pay the electric bill for the employee. So they all had something that got their staff to tell them the truth. Whereas in the homes that don't do so well, they did not have that. They
Mhm.
might be asking the staff to tell the truth, but they weren't giving the financial backing to ensure that they told the truth.
Mhm. And also, from the research you did, it also seemed that they also developed, in addition to that piece of that relationship, a trusting relationship where the staff knew that the management, the administrator would work with them if they needed to take care of their own families, for example, or if they needed flexibility with their job. Could you talk a little bit about some of those examples?
Sure, sure. In one case, a lot of the residents moved out of the assisted living portion of their home. So the staff were worried after working in the red zone. So they said, stay here, move into these empty apartments over here. And then they stocked their refrigerators with the drinks and snacks they knew the staff liked, and let them bring their pets, and they purchased hotel rooms for them. They gave them prepackaged meals to take home, and what they called care packages that were full of, paper towels and toilet paper, which were hard to come by at some
Right.
junctures, right? But they had, lots of industrial toilet paper and paper towels that they could get easily. So they were giving it to their staff. So they did whatever it took to tell the staff, we care about you, we care about your family. In some cases, when the staff would call and report, I have symptoms, they would go to the staff's home and test them in their garage and test their family members and deliver PPE to the house. And, so they very much cared for the family, just like they expected the staff to care for their residents' family. And
Mhm.
over and over again, they demonstrated that.
That's critical because it didn't ever put the staff then in a position of having to make a choice,
No,
because they knew that their family would be cared for, that they could devote whatever energy they needed to do that. But at the same time, they would be willing to show up and work to support each other. And my guess is that the staff then were also more willing to support each other if somebody needed some extra accommodation of some sort, like an extra hour here or there, or an extra shift. The staff were willing to fill in for each other because they knew they would get the same back if they
yes,
needed
they
that
were.
as well. Mhm.
Yep, favors would be reciprocated, in a nursing home that kind of feels like family, those types of favors are reciprocated. Oh, you cover for me, I'll cover for you. And
Mhm.
oftentimes staff work that out without management having even to get involved. But in
Mhm.
addition, the leaders gained the trust of the staff because of some of the prevention and mitigation strategies that they did employ that were much different than what you find in nursing homes that struggled. For example, as soon as the rapid point of care antigen test kits arrived from the Department of Health and Human Services in September of 2020, that was a game changer for them. They never went back to lab-based testing just for confirmatory stuff. They peeled open the box and they began doing rapid testing on very aggressively, before it was required. They were testing visitors, they were testing their staff twice a week as a means of surveillance. I mean, they just went for it. Again, contrast that with homes that are still struggling today. Many of them are still wed to PCR testing, and oh, we get the lab results back in 24 hours. Geez, you could get it back in 15 minutes, right? Like, what are you
Right.
doing, right? So, that's one piece. And the staff, of course, are getting tested, and they're seeing everyone get, and they're realizing that working here is probably the safest place I could possibly be. There's so much testing going on, right? So that was
Mhm.
one piece. The other thing is they achieved very high vaccine and booster rates before it was federally mandated. So that gives all the staff peace of mind and all the residents peace of mind, right? And
Mhm.
how did they do that? The old-fashioned way. They worked at it. They tried to do, they set
Yeah.
goals, and they employed at least 9 different strategies on average to get it done. You do not find that in homes that are struggling today with 20% of their residents who've gotten the new bivalent booster. They're not putting their shoulder to the wheel. These facilities put their shoulder to the wheel to get that done. And then
Mhm.
finally, they cleaned the air. They knew the virus was in the air, so they bought air scrubbers and air
Mm.
purifiers and foggers, and staff would see these devices and watch them fogging. And while at the time they didn't know if it was working, it was definitely working, because you do not find that the homes that struggled have done anything to clean their air. They don't have
Mhm.
any scrubbers, they don't have any purifiers. They haven't touched their HVAC system. These homes, went on YouTube and found ways to create and turn their old air conditioners into negative pressure devices in rooms. They just went all out, and the staff saw the leaders going all out, and they
Mhm.
knew that they were like ahead of the guidance and doing it right. And staff would make rounds and say, why aren't you wearing your mask right? So, you know, all of that made these staff members feel safe to come
Mhm.
to work, right?
Mhm.
And, if you didn't feel safe to come to work, you weren't coming to work in a nursing home. And as 225,000 staff left nursing homes. Why?
Right.
They didn't feel safe.
Right. Well, and putting all of those pieces in place obviously was very critical, and having some foresight and doing planning, seemed to be really critical, like not waiting until it was at your doorstep, which is, one of the concerns that I had so much during the pandemic, particularly, it hit some areas quicker than others, obviously, but you could see it, coming across the country. And so I would imagine that those who did better really were watching and employing the variety of strategies like you're talking about, but as well preparing their staff for what was coming too, to say, we've got to be ready for this. We can't wait until it's at our doorstep.
Sure, sure. It was not a federal response, it was a local response. And as such, these leaders could see what the state of New York was putting out for guidance, and know in California, well, it's just a matter of time till that's our guidance too. So maybe we should like do what New York is doing before,
Mhm.
the California Department of Health tells us to do it. And that was their mindset. They were reading the news everywhere and knowing that, if New York's requiring twice a week testing and we're doing no weekly testing, then eventually we'll have to. So we might as well just do it now. And sure enough, they would. And then California would respond. So they were just ahead of the guidance. They were much more likely to implement guidance before it was required. They were much more likely to sustain the integrity of whatever it was. And now that the guidance is being pulled back, they're the last ones that are going to pull it back. They honestly are. Here in California on April 3rd, you don't even have to wear masks in nursing homes anymore.
Yeah.
Not at these facilities. The staff will still be wearing masks, that's for sure.
Did you find that, you talked about communication a little bit earlier and how important that was in terms of keeping staff well informed about what was happening, kind of the strategies that were going to be employed? Were they also having good communication with the families and the residents as well as the staff?
Yes, they did a remarkable job in that. And again, you see wide contrast and variability there. But in these homes, we asked specific questions about that. And some of their best practices were to make sure that they all purchased a lot of iPads, of course, so they had the technology. But then they made sure not to burden the CNAs with, set up that conference call or teach that resident how to connect with their daughter. They always had specialists, and they were usually the activities or recreation staff, but they made sure that the people who really knew the technology were the specialists, and they would do all the organization. One home I remember said that they organized 23 window visits in one day.
Wow.
So once again, it was a situation where if you really worked at it to keep residents and families connected, you absolutely could with just a few purchases and best practices. If you just kind of dumped it on the CNAs who were already short-staffed and said, help them with calling the daughter, it failed miserably, as you would expect. These were the first homes that developed the concept of hug tents and things like that you saw in the news. So they were leaders in every aspect of keeping residents and families connected. Oftentimes they would have a webinar for the families about what was going on in the home. Every Friday was their community meeting with residents, families, and staff. And so that was a common practice for them to always have a weekly webinar to keep the families informed from a policy standpoint, what was happening in the home.
Yeah, I think, if I would hope that there are nursing home providers that are listening to our podcast and recording today. And certainly, from a consumer perspective, would say one of the biggest frustrations we heard from families during the pandemic was the lack of communication that they were receiving from their nursing homes where their loved ones were living. And those that had better communication style, that we're constantly sharing information. This is what's happening here. This is what we're doing. Here's how we're trying to protect your loved one. Here's the situation of what's going on in this facility, having the webinars or the Zoom meetings or, whatever it took, the constant emails or phone chains. They're the ones that the families are complaining less about because they felt that they were part of the community that was, they're working together to protect the residents.
Sure. At NHC Sumter in South Carolina, they assigned every department head to take 15 residents and their families, and they were required to call go and visit with the resident and call the family every week, and they did it for a few years. And it's amazing how helpful a maintenance man can be in a situation like that. And family members, she said that the family members still want to talk to the maintenance man.
Yeah.
Like, that's how much they love
Of course.
after that relationship was developed. And so yes, once again, similar to the vaccination, it's an effort thing, really it is. It's an effort thing. It's not like anything special they did. They just worked harder at it, just like vaccinations and boosters.
Yeah, absolutely. One of the other pieces with respect to the leadership that I think, I would imagine made such a big difference for staff was they saw their leaders out kind of in the trenches with them on a regular basis. They weren't sitting in their offices with the doors closed or only coming around once a day for rounds or whatever that was. They literally got in there and were part of the team and got their hands dirty.
Yeah, absolutely. These are in the trenches type leaders. Most of the DONs we interviewed had scrubs on. That's how they come to work every day. And they told us, when we had to open our red zone, me and the IP were the DON and the IP were the first, ones to volunteer to be the nurses on the unit for the first 12 hours, right? And
Mhm.
so they would come in on nights because had particular concerns about nights. We oftentimes in a nursing home, you would find the night shift has the lowest vaccination rate. They're the less likely to wear their masks right. They're the ones that usually get tested the least. So lots of risk on nights from a COVID perspective, and they intuitively knew that, and they were coming in more at night, and they were bringing food. They weren't just bringing a whip. They were
Right.
bringing food, and I think that helped too. Quite honestly, everything that I'm sharing with you, from addressing the air, high vaccination rates, going with point of care antigen testing, is all evidence-based now. They
Yeah.
just did it before it was evidence-based, which is
Right.
pretty remarkable.
Absolutely. Absolutely. I think, we talked about the foresight, the planning that, went involved. So, it's not that these facilities were lucky. They did their work, and they planned, and they put the hard work in to inform themselves, inform their staff, and put a plan in place that was going to help them be successful.
Yes, yes, they were very clear that no matter, where it was, if it were even if some didn't even get hit till November 2020 for the first outbreak, which again is a testament to how good they were doing, but they never led the staff to believe that it wouldn't hit them too, and they were really studying the facilities around them that did poorly and learning from it. And one thing that they really understood quickly was how dangerous PCR testing and moving and cohorting residents were, because PCR testing has an unknown test turnaround time, 48
Mhm.
hours, 4 days, who knows. And so you're really finding out who was positive 2 days ago, when you
Right.
get those results back. So you're always like, oh boy, well, those employees just work two doubles, and, oh geez, right? And so these are leaders who would look at the cohorting guidance and look when they got their test results back early on. And in many cases, they were like, we're not moving COVID around. We're just not doing it, right? And they would consult with their medical director and the local public health department, and they would close the doors of that unit rather than move it around. And that was an interesting theme that we saw early on, how they would
Mm.
buck against that cohorting guidance, which it was completely rational what they were doing. And then, of course, when we had the rapid antigen testing, then they were more likely to move people because,
Sure.
in 15 minutes, you can more safely move someone around.
Sure. These different facilities, we talked about how they were in different locations, different sizes, but they didn't have any special resources. They didn't have a special resident population. They were really like, this could be any long-term care facility with good leadership, good program and practices, right?
Sure, sure. We're talking about, homes in the city of Oakland and rural South Carolina, rural Missouri, St. Louis, Missouri, and in New Orleans and rural Louisiana. So they're very diverse. And absolutely, the key take home is that any nursing home could have pulled off what the outliers did. The homes in Missouri and South Carolina, Louisiana were located in, counties of concentrated poverty, right? With very low vaccination rates, where husbands and wives or employees are saying, don't do it, right? So what they achieved was remarkable, and they
Mhm.
achieved it because they were, again, good leaders, and they had some key organizational practices in place that garnered the trust and engagement they needed to get through that time.
And do you think that the strategies that they employed in these facilities that resulted in them being these outliers, that they were resulting in maybe better outcomes in day-to-day operations, even outside of COVID, that they served the facility well before the pandemic hit, they continue to employ these practices after, and they and their residents will have better outcomes, lower turnover, better staff stability, all of those things that we're working towards down the road?
Sure, sure. These are high performing 4 or 5 star facilities, who budget their staffing to be 4 and 5, right, and get those outcomes. They choose to be successful. They budget to be successful, and they are. They're also profitable, right? And they're achieving great results and good business results. It's a win-win for everybody, and the staff are being rewarded. So these homes are successful across a broad base of performance metrics.
Mhm. So in the article, and for those that are listening, we'll certainly be happy to share information about the article on the Consumer Voices website at www.theconsumervoice.org. You talk about an educational series that was developed that hopefully will help others learn how to employ these good practices. Could you tell people a little bit about that series and how they could get more information about it?
Well, sure. Well, we've, just developed a presentation to kind of capture this, and we delivered it at the Consumer Voice Conference. Now it's further refined after more interviews and more states. And that will be delivered at the ACA Quality Symposium in May. And after that, we'll be taking it around South Carolina this summer. And I just delivered it here in California at the CAF convention. So we're really trying to get the word out that
Great.
the outliers exist, and this is what they did. And are some of the lessons we should all learn before our next wave, whether that be in July or in the fall, whenever it is. COVID is still with us. It's still, affecting nursing home residents. And nursing home leaders should be employing the tactics that we find in these outliers.
Well, absolutely, David. And I thank you for the work that you have been doing. And certainly these best practices are ones that we would really like to see replicated across the country. And we'll certainly do whatever we can to help share them. So thanks to those of you for listening to us today. This is Pursuing Quality Long-Term Care. And you can get more information about the things that we're talking about today, about staffing, about good care practices, about rights issues on the Consumer Voices website at www.theconsumervoice.org. David, thank you so much for being part of the program today.
Yes, thank you.
Thanks for joining us on Pursuing Quality Long-Term Care. This podcast is a program of the National Consumer Voice for Quality Long-Term Care. Make sure to visit our website, theconsumervoice.org/pursuingquality, where you can subscribe to the podcast, follow us on Facebook and Twitter, and find more information and resources. If you enjoy the podcast, please rate, review, and subscribe. Thank you for listening, and we'll see you next episode.